Namaste. I am Dr. Nilakshi Deka, consultant endocrinologist at Apollo Hospitals, Guwahati. The question that I would like to address today is what is the difference between random blood sugar and postprandial blood sugar? Now, first let us know a few terms that are used in diabetes. Now, when we are talking about diagnosis or detection of diabetes, we talk about 3-4 parameters, like we talk about fasting or FBS, which is fasting blood sugar. We talk about PPBS, that is postprandial blood sugar, which is 2 hours after a meal, and then we talk about random blood sugar. So random blood sugar is something which has nothing to do with the meal that you have consumed. It could be at any time between any time from a meal. It could be 2 hours, it could be 3 hours, it could be 6 hours, it could be anything. So random blood sugar can be done at any point of the day. And then we have another parameter called HbA1c, which actually detects or which actually gives us a value, an average value of blood sugar in the past 3 months. So the concept of random blood sugar is also very important, because when you are doing a diabetes, when we are doing a diabetes detection camp, patients may not come to you in a fasting state. They may not come to you just 2 hours after beginning of a meal. They might come to you at any time of the day, and so a random blood sugar gives us a good idea, or is a good way actually to pick up new onset of diabetes. I would not say random blood sugar is a very good option to actually look at the blood glucose monitoring or management once you are already diagnosed with diabetes, but to pick up diabetes for the first time in an individual who is not aware of his diabetic status, I think random blood sugar is a very good option to actually pick up these new cases. Random blood sugar can be done at any time of the day, irrespective of the last meal that the patient has consumed. So that way it helps us in getting or picking new cases of diabetes. So when a person has a random blood sugar of more than 140, we should be cautious. The chances are that the individual may have diabetes, and so he needs to be evaluated the next day. Maybe you can ask him to come the next day in the fasting state, and then ask him to consume a meal and do the test once again after 2 hours. If a random blood sugar is more than 200, that gives us a diagnosis of diabetes. So an individual having a random blood sugar more than 200 harbors diabetes. But for an individual who is already diagnosed with diabetes, so a random blood sugar of more than 200 would imply that a patient has a bad blood glucose, and we do not blood glucose level, and we do not tend to the patient has a bad sugar in an individual who is a diagnosed case of type 2 diabetes. Again, random blood sugar may have a value when you have to detect hypoglycemia in an individual who is an already diagnosed case of diabetes and who is on medication, because in that case a random blood sugar of less than 70 would mean that the patient is having hypoglycemia or low blood sugar, and hence he needs to take certain corrective measures in order to gain back his blood glucose levels to the normal levels. That is, he has to consume some sweets and then take complex carbohydrates so that his blood sugar comes up to normal again. And once this random blood sugar shows hypoglycemia, it is not only the immediate reactionary or reactive step of taking sugar or taking complex carbohydrate. In that case, the individual's management plan has to be again revisited, and we have to make alterations in the patient's medication, be it oral hypoglycemic agents or be it insulin, so that his tendency or predisposition to further episodes of hypoglycemia is prevented, because hypoglycemia can be a deterrent in achievement of good glycemic levels.